Transphenoidal Tumor Resection. Introduction. Can you point to the pituitary gland? Choose one of the following options. Correct. The pituitary gland controls most hormones of the body. Select true or false. Correct. The pituitary gland controls most hormones of the body. All pituitary tumors need to be taken out surgically. Select true or false. Correct. Some tumors are responsive to medications and may not need to be removed. These are usually small, prolactin-secreting tumors. Other tumors may be small and not hormonally active. These may also be kept under observation without treatment. Are heart attacks and other anesthesia-related complications common during and after pituitary tumor operations? Select yes or no. Correct. Anesthesia is now very safe. However, the older you are and the more medical problems you have, the higher the risks. You should make your anesthesiologist aware of any medical problems you have had in the past, such as heart attacks and lung problems. Serious complications such as blindness, strokes, or even death can occur after this surgery. Select true or false. Correct. These, as well as infections and other problems, can occur. However, it is very unlikely for such things to happen. Thank you for using Explain.